In this chapter, I started telling you all about two-dimensional imaging. But from a historical perspective, it was not 2D imaging which was first, but it was M-mode. And this is the textbook that I learned echocardiography from. It's the famous Feigenbaum, the second edition. And if you take a look at the images in this book, you will see that most of these images are actually M-mode images. Of course, M-mode has lost a lot of its importance. But still, if you know how to interpret M-mode images today, you will also get much, much more out of echocardiography. And how can one best explain what M-mode is? Well, just imagine the finishing camera during a horse race, which is positioned exactly at the finishing line. It records the horses as they pass the line. This is M-mode. So this graphic should help you understand how M-mode works. We have an ultrasound ray which is emitted, and if it hits a boundary of the heart, it gives a reflection. Another reflection here, another reflection here. But since the heart is moving, the boundary also moves, and therefore we have the typical M-mode tracing. Don't forget, this is the time axis, and this is the depth of the ultrasound. We can now delineate exactly which structures we see. Here we have the right ventricle. This would be this area here. This darker area is the septum. Here we have the cavity of the left ventricle. And here we have the posterior wall of the left ventricle. And we can see how this structure moves from diastole to systole. Even though M-mode is an old technique, it has a number of advantages. The first advantage is we have a very good time resolution. We can really see fast or quickly moving structures very nicely. Here is the aortic valve, and you can see the flutter motion of the cusps. The second advantage is we can really perform good measurements which involve timing of events. For example, from the beginning of the QRS complex maybe to the beginning of the aortic valve opening, and many other. And if you have a lot of experience, as many colleagues do who grew up with M-mode, then you can really get a lot out of this technique. In the following demonstration, I will now show you how we can acquire an M-mode tracing. To get an M-mode, we use 2D as a reference, and then we place a line through our sector, and the M-mode displays and records everything along this line. So everything that happens along this line is displayed here on a time axis. So the septum, which is this structure, the left ventricle right inside here, and the posterior wall. What is it good for? For measurements, for example. And you can also change the gain settings and also, for example, the time scale. So this is M-mode. So in which situations and in which positions do we use the M-mode? Well, most frequently we actually use it to measure the left ventricle, but also for the aorta and the left atrium. Other potential applications are the mitral valve and for the detection and for the assessment of prosthetic valves. However, I would say these two indications do not really have very much clinical applicability in modern echocardiography. Keep in mind that M-mode is also an ultrasound technology, so we can also have artifacts. Here are some examples of artifacts in an M-mode image. At the beginning of this section, I told you that the M-mode technique is a fairly old modality in echocardiography. But still, there are a number of advances which help us use M-mode in daily practice. Marian's going to show us now what I mean.
Now I'd like to show you a very nice tool called anatomical M-mode. In some patients, you cannot get a really 100% nice parastern long axis view which is properly aligned. In this case, you may need the advantage of the anatomical M-mode. So you start with a normal M-mode and then go to anatomical M-mode. You see, you get a green line over here. So what happens? The system takes your complete 2D image data and you place this green line in the area you want to display the M-mode. The system then takes from the 2D image just all the dots along this green line and shows it for you as an M-mode. You can change this line by just taking the trackball. You change the position you have the small sample volume in the middle. This is to angulate, to define the angle. Just press the enter button, and then you can change it and make a real proper acquisition now. This can be done in the live scanning. You can also freeze the image, you make your measurement, and then you can also move the cursor even more. Go, for example, to another structure, aortic valve. Again, also adjust the angle, and you can do your measurements here. So you can do it in live, you can do it in post-processing, you can even do it just from a 2D image. When you store a loop, you can even do it afterwards. So what is also important is, since it is based on the pure 2D image, is the frame rate in order to get a good resolution. You see here now I have had very good frame rate, but I will show you how it looks like when the frame rate is really very low. I make the sector quite very wide. Now I have only 26 frames, and you can see immediately that the resolution of the M-mode is not as good anymore. This is just basically because the frame rate is too low and you don't have enough information. So always make sure you have a good frame rate just by decreasing the sector, and you may use the frame rate button.
So in summary, the anatomical M-mode allows us to place the ultrasound ray anywhere we want to. So we have freedom of access. The only disadvantage is we do, I guess, lose at least some image quality. But there's also something else we can do with M-mode. We can combine it with other imaging modalities, for example with tissue Doppler. Here's such an example where we have the typical overlay of the tissue Doppler signal on the M-mode. In a later section, we'll talk about the importance and the relevance of tissue Doppler. And here we are combining M-mode with color Doppler. The importance of this will also be discussed in later chapters. So this completes the subchapter on M-mode. And don't forget, you will find plenty of M-mode tracings also in our atlas. But now let's turn away from the motion of the heart to the flow within the heart, to the flow dynamics.